Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health Center, reporting for the week of November 28th, 2022. Today, I'm going to talk about COVID and its variants, as well as RSV and flu, and how we can stay prepared for winter. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Here in Alameda County, our total cases over the previous 14 days is roughly the same as what we were seeing last week, still over a couple thousand. And we know this is highly dependent on people's testing behaviors. So we certainly rely on other indicators like hospitalizations. Unfortunately, this has not been updated for Alameda County since November 18th. But on November 18th, it was continuing to climb with 86 in the hospital and 17 of those in the ICU with COVID-19. We can look at the wastewater, though, for a more early indicator, and unfortunately, it is continuing to climb up. So this is wastewater for the East Bay Municipal Utility District, and that is showing an increase in the concentration of SARS-CoV-2. And when we look at deaths nationwide, unfortunately, we are still just right around the same area that we've unfortunately been in for almost 9 months now, sort of fluctuating between about 300 and 550 for the last 8 months. And prior to that, we know we got as high as 2,500 a day in the Omicron surge. So 300 deaths a day, 2,100 deaths a week. These are still pretty staggering numbers here. And once again, I think we should consider every COVID death and every COVID hospitalization a failure of some sort, and we really need to understand what happened or what didn't happen that led to that, because we cannot accept this many people dying in the United States every single day during what we're calling a lull, because we are obviously anticipating heading into times where we're not in a lull and where we have increases in cases, and we do not want to see this number go back up. As it relates to the COVID variants, we're still seeing that the BQ1 and the BQ11 continue to increase. And so now they are making up almost 60% of the sequences that we have here in the United States. Wanted to call your attention also to this XBB, which has made it on the scene. It wasn't showing up when I reported last week, but you can see here in kind of this orangey, peachy, bright kind of color that the XBB is here. It is 3.1% on average nationwide, a little over 5% when we look in region 2 here, which is the region that has New York. So they've always, for this whole entire time, kind of been a little ahead of us in terms of seeing increases. So we don't know exactly what this means clinically. We know that it has caused some trouble in other parts of the world, but we're not really sure what the clinical implications are going to be, other than to say that this one is quite immune evasive, like the BQ11. So we're pretty concerned about the BQs and the XBB because they're getting around some of our prior immunity. Like if you had a BA1 infection, those antibodies don't seem to work against XBB or the BQ, which really gives concern for how fast this could increase and spread if prior immunity does not help. Also of great concern is the fact that the XBB does get around our monoclonal antibodies. And so I've been mentioning that at some point we're going to hear that we can no longer use these monoclonal antibodies. We haven't gotten that word just yet. However, we know that here locally at Stanford, they have actually had a change to their outpatient treatment, and they've stopped actually giving Evusheld, which is the one that we use for people who are immunocompromised, and they've stopped giving the bebtelovimab as well. And so we know that they are not going to be effective against these variants, and because these variants are really taking over, we are going to have to move forward with a different strategy, unfortunately. And so for those who were eligible for Evusheld because they're immunocompromised, we're going to be recommending certainly that they get the bivalent booster, which was the recommendation anyway. But the concern is that folks with immunocompromise or who are taking medications that may impair their immune system just won't mount a good enough response with the bivalent booster. So in addition to boosting, we're really going to have to lean in on those other mitigations, like not gathering in crowded indoor spaces, wearing a high quality filtration mask like an N95 or a KN95 or a KF94, and just avoiding exposure, generally speaking. And with respect to treatment, we know that the monoclonal antibody bebtelovimab was something that we have been using for quite a while now, many months now, effectively. And unfortunately, with these new variants, that is no longer kind of going to be a good strategy. So we can kind of strike it off of our list, unfortunately, now. So even though we keep saying we have the tools, we're actually losing some tools here. So Paxlovid remains the #1 choice in most cases. Remdesivir is #2 in most cases, and molnupiravir is the last choice, not nearly as effective as choice 1 and choice 2. But unfortunately, we no longer have the monoclonals in our armamentarium, or its utility is vanishing very quickly before we head into any kind of winter surge. So that is unfortunate news. We are hearing some news that there are some monoclonals that are being looked at, they're being studied. They appear to all be in either phase 1 or phase 2 of trials, so nothing yet in phase 3. So it might be a while. The likelihood is that we will need to make it through this winter without benefit of monoclonal antibodies, which is very unfortunate. But we know that monoclonals are quite specific. And what is being studied right now is looking at sort of different targets against the SARS-CoV-2. So we're certainly hopeful that what we'll get next will be more effective, maybe even last longer, but it will be some time before we get there. I wanted to touch on measles. Unfortunately, I have to touch on measles because right now we are in some danger as it relates to measles. And why is that? Because we have susceptibility based on the fact that we have lapsed in our vaccination of children against measles. So the World Health Organization and the CDC came out to say that this is a problem. We've got nearly 40 million children who are dangerously susceptible to a growing measles threat. So not only do we have a lapse of vaccination over the last couple of years, but we are seeing, as a result, outbreaks. Outbreaks have been reported in 22 countries, some worse than others, some more deadly than others. In Zimbabwe, for example, there have been about 700 deaths already, most of them children. In Afghanistan, there's been more than 350 deaths, again, most of them children, and these are large increases from the year before. And when people die from measles, it is typically from encephalitis, so that is brain swelling. And even if you don't die from encephalitis, it can have some long-lasting effects. So this is nothing to be playing around with. And we know that measles is highly, highly contagious, that if a person has measles and they cough or sneeze, they can spread it to a lot more people than even SARS-CoV-2. It's so contagious that if that person was in a room or around 10 other people, then 9 of them would get it. Now, these are unvaccinated people. So this is a lot of spread from one individual. And oftentimes we use measles as a comparison of the most contagious thing that we contend with, really. So this is not something we want to play around with. And we were doing really well. So a lot like polio, we were doing really well. In fact, in 2000, the United States declared victory over measles, and that we had eradicated it because we hadn't had any cases in over a year. But unfortunately, that's behind us now. We are now back in jeopardy as it relates to measles. And this is because an estimated 25 million children have missed their first dose, and another 14.7 million children have missed their second dose, all in 2021. So this is about 40 million children worldwide in 1 year. This is a record high of lapsing on the measles vaccine. This is not good news. Here in the United States, Ohio has reported an outbreak. There were 32 confirmed cases of measles among children from 12 child care centers and schools in the Columbus, Ohio area. These were all children under 5. Most of them were under 2. 13 of them were hospitalized. And 31 of the 32 definitely were unvaccinated. One of them, they're still trying to figure it out. But we know that the measles vaccine is very, very effective. This is how we almost eradicated measles. But remember, measles can travel, just takes a plane ride to come from another area of the world. And the reason why we don't see large outbreaks here in the United States is because we had such good vaccine coverage. But now we have elapsed in that regard. And so we're now susceptible again. Now, the measles vaccine is the MMR vaccine, so it comes with mumps and rubella, so measles, mumps, rubella. And mumps and rubella are nothing we want to be getting either, or having our children get either. So MMR is really important for the measles, the mumps, and the rubella. The first dose is between 12 and 15 months of age, and then the second dose is between 4 and 6 years of age. So it's a 2-dose series. Simple as that. Adults, if you've never been vaccinated for measles, it's either 1 or 2 doses. So you'll need to check with your doctor. It just depends when you were born and if you're truly completely unvaccinated. Now is a great time to get caught up on vaccines. Let's get those checkups scheduled for our children and get those catch-up vaccines. Now, as it relates to flu, we're having a rough flu season already. It's early and it's hitting us hard. The week ending November 19th, the positivity rate for flu nationwide was over 18% positivity. The week before that, it was about 14%. So positivity rate is climbing. Almost all of our cases this year are influenza A. And out of those, about 78% are the subtype called H3N2, and 22% are H1N1. The CDC estimates that so far there have been 6.2 million people who've gotten the flu already this season. 53,000 of those have been hospitalized, and 2,900 have died. 12 of those have been children, and just out of those, 5 of those were in this past week. Here in Alameda County, there were 19 admissions for flu in this week ending November 19th. That is double what it was the week before. And that was double what it was the week before that. You can see that the wastewater for influenza A is also just heading on up. Glad to see that we've got wastewater data for influenza A. We've also got wastewater data for RSV, and you can see that is also heading pretty sharply up. Also, if you look at RSV detection, so this is cases nationwide, those are continuing to go up pretty steeply. You can see that they have exceeded considerably our peak from last year. Our hope is that we will peak and come back down soon. Don't know when that will be, but it just appears that we're having another early RSV season, but this one has been hitting our hospitals fairly hard. A lot of our pediatric units have been stressed and strained. And so we really want to do what we can to obviously avoid catching RSV, but unfortunately for this one, we really don't have a vaccine or treatment. So the best thing to do is avoid catching it in the first place. So now I am going to talk about how we get ready and stay ready for winter. Winter is coming. It is respiratory illness season, always has been, but we know that right now we've already got an early RSV season, got an early flu season. We've got COVID still lingering around, and we certainly anticipate it going up. And while we know that cases will go up, we can prevent hospitalization and death. So there are a number of things that we need to do. First off, stock up on masks and tests. So you can purchase these things now. They're not as scarce as they once were, or you can get them from your local community health center, like Roots Community Health Center. We are giving away care kits that have the tests, that have the N95s, or you can just ask for what it is that you need. This is something we want to get out into the community as much as possible. And many other community health centers are doing the same. And the next is to know where, when, and for what to get tested. So it is respiratory illness season, and COVID isn't the only thing that we need to be concerned with. When you come to the Roots testing site, we are typically able to test for SARS-CoV-2, influenza A, influenza B, and RSV. So this can be important because it may guide what it is that you do next, especially if you are someone who is at risk. And I'll talk a little bit more about that in just a moment. So even though our home tests are great, they're convenient, they only test for COVID, and they don't pick it up as quickly as a PCR test. And typically, if you're going to your doctor and you're getting swabbed in your nose, then it can't be sent off for more than just SARS-CoV-2. And that is something that you may want to ask your doctor about, because it's not just COVID that we are worried about. And depending on who you are, what your risk factors are, we may be just as worried about some of these other respiratory illnesses. So more on that in a moment. Next is get up to date on your vaccinations, yours and your children, your loved ones, everyone around you. We know that we have the COVID vaccine. Let's not forget that in addition to the mRNA vaccine, we have Novavax, which does not use mRNA. So for those who were concerned about the mRNA, you've got a vaccine with the more traditional technology. So please consider Novavax. Tell your family and friends who have not been vaccinated yet that now they have an option with the Novavax. Everyone 6 months and up can get a COVID vaccine and can get a flu vaccine, and should. And this importantly includes pregnant people, because like I just said, the COVID and flu vaccines are only available when you become 6 months old. So how do we protect our 0 and under 6 month old babies? Pregnant moms get vaccinated. So please, please, this is very important. Not only does it improve outcomes for mom, should they catch COVID or flu, but this also protects the baby before they're born and protects them throughout those first months of life. So it's very, very important for pregnant people to please get the COVID and the flu vaccines. And remember that for everyone 5 and up, the COVID booster is also recommended. And while you're at it, can we get the polio vaccine, get the measles vaccines, get caught up on any vaccines that you may have missed over the last couple of years? This is super important. Next is know what your treatment plan is, not just for COVID, but also for flu. So quick review on COVID treatment. Paxlovid is typically going to be our treatment of choice. There are some things we have to consider. There's certain medications that you'll have to hold. You might have to hold them the whole 5 days that you're on Paxlovid, and for another up to 5 days after that, just depends on medication. These are things your doctor needs to know about. Doctors don't get to opt out of treating COVID. This is now becoming bread and butter, and it is very important that your doctor knows what they're talking about when it relates to COVID treatment. And if they don't, maybe you might need to find another doctor. So this is important. I want everyone to have a primary care doctor, and I want them to have a primary care doctor that knows what they're doing when it relates to COVID treatment, or at least knows how to find out, because I don't want to hear any more stories of people who obviously needed Paxlovid not being able to get their hands on it. And I have serious questions about these 300, 400, 500 people dying a day. How many of them got Paxlovid? We know the numbers are low. I don't have the data I would like to have on that, but we know that the numbers are not where they need to be. And we don't need to have any more people dying of COVID, especially when they could have taken a medication that reduces their risk of hospitalization and death by over 80%. So yes, Paxlovid reduces the risk of hospitalization or death by over 80%. And so does the second choice, remdesivir. So if there is a medication that you're taking that truly absolutely cannot be given with Paxlovid, there aren't that many of these. Cholesterol medications are not one of them. Blood pressure medications are not one of them. You can hold those medications. So that has to be done in consultation with your physician, because sometimes they may want you to, like swap one medication for another. There is a lot of nuance here, but this is nothing that is too hard for a doctor to handle. So please advocate for yourself and your loved ones on this. Paxlovid may also reduce the risk of long COVID. We don't know how much. There have been different studies out there that some of them conflict with one another, but it does appear that there is some reduction even in long COVID, which is certainly welcome news as we learn more and more about long COVID. And remember that rebound can happen with or without treatment. It can happen with Paxlovid. It can happen with any of the treatments. This is probably part of the natural course of COVID itself. And I went over this in a lot of detail, including a bunch of studies in the July 12th briefing. The link to that is in the post if you're interested. But the fact of rebound should have zero bearing on the decision to treat. Zero bearing on the decision to treat. Why? Because even with rebound, these are not severe, these are not causing death, these are not causing hospitalization. So in other words, the effectiveness of Paxlovid remains whether or not there's any sort of rebound. The downside of Paxlovid is that, again, you may have to pause some of your medications. This might be tricky just depending on what the medications are. But for the most part, it's pretty straightforward. It's just about holding the medications. There's also some people have some nausea kind of side effects, a metallic taste in their mouth. These seem like a very small price to pay. We're really not hearing a lot in the way of any kind of significant side effects here, yet it is absolutely life-saving. So please, let's get this figured out before you catch COVID. If you're someone who should get Paxlovid, I would like for it to just be waiting for you at the pharmacy, or you have a bottle of it on hand. Wouldn't that be nice? I don't think we're quite there yet, but it certainly would not hurt to ask your primary care provider. But definitely, you can have a plan and know how you're going to get it. And know how you're going to get it even if you find out that you caught COVID over the weekend. How do you reach your doctor? How do you get that prescription called in? Because we're just having way too many people scrambling while they're sick on the weekend, and this just seems like it's unnecessary and it shouldn't be that hard for us to fix this. And remember that if for some reason you're unable to get Paxlovid, but you still could benefit from COVID treatment, there's also remdesivir or even molnupiravir, not my favorite. It's not that effective, but it reduces the risk of hospitalization and death by more like 30%. That's still better than zero. So if for some reason you're unable to get Paxlovid or remdesivir, then that is the third choice. Now, what about flu? So with the flu, most people do well with the flu. They recover fine. It's not very comfortable, but there are antiviral treatments available, and they are recommended for certain people, and they actually can be beneficial for anyone with suspected influenza, as long as it started within 48 hours of illness onset. So nobody has time for the flu. If you act fast enough, you can actually receive treatment and improve your course, shorten the duration, etc. But who we're really worried about and who we really want to be ready to get that antiviral treatment should they catch the flu is anyone. First of all, if you're hospitalized, then we're going to be treating it with the antiviral medication. But even as an outpatient, there are some definite indications for outpatient treatment of the flu. And that is if you are at high risk for influenza complications. This is a very long list. I have linked it in the post, but this includes adults 65 and older, children that are under 2. Remember, the extremes of age are when we worry about the flu. People who can do poorly are usually in those extremes of age. Folks with asthma or other respiratory conditions, diabetes. Again, it's a pretty long list. You should check it out. Or anyone who's having kind of a severe or complicated illness. But one thing to note, I think 2 things to note that are important about this is, one is that if you need to be treated within 48 hours is really when we need to act. So we need to act quickly. And the second thing is that we don't need to wait until you have a confirmed flu test. Now, again, if you come to Roots testing site, we turn those around quickly. The results of all 4 viruses, flu A and B, COVID and RSV. But if you, let's say you get a regular test that gets sent out to the lab, and we suspect that this is really the flu. We've got a lot of flu going around. You have all the signs and symptoms of flu. Maybe your COVID test was already came back negative. You don't have to wait for the flu test to come back. It can actually be treated for suspected flu using the clinical judgment of your physician. So this is for people who are at risk of severe disease. So this is something to certainly consider. Also something to, again, have a treatment plan. Speak with your doctor now if you fall into any of these groups. If I catch the flu, should I be treated? If I catch COVID, should I be treated? And what is the plan? You absolutely have the right to this plan and to this information. Now we're having a bad season already with respiratory illnesses. We anticipate it will get worse, so it's better to stay ready. And my last tip on staying ready for winter is to know the signs of respiratory distress. This is not just for yourself. I think you'll know if you are in respiratory distress, if you're feeling short of breath, having trouble getting air. But I think it's important for all of us, almost just like, knowing basic CPR and things like that. It's good to know signs and symptoms of respiratory distress, especially for babies who can't tell you what is going on, but may be getting into respiratory distress. And so the signs of respiratory distress, and these all basically come about because you're struggling to get more oxygen and you're working harder to breathe. So if you think about it that way, you're working harder to breathe, then a lot of these actually make sense. So breathing will get more shallow, shorter breath. You may hear grunting sounds. The chest may be caving in with each breath, or it just kind of looks like the belly's going in when the chest is going out. It just looks kind of like it's not synchronized like normal. That you may see the chest kind of going in even kind of right under the neck area, or you might just see extra muscles. Looks like the person's using extra muscles like in their neck in order to breathe. The skin can turn a bluish hue or purplish. Certainly if someone is really fair, you might be able to see this. Definitely with darker skin, you're going to want to look at the mucous membranes, look at the mouth, around the mouth, look around the eyes. And the skin might look sweaty, but to the touch, it'll feel cool. So skin will kind of get clammy. You may also see a person leaning forward to get into a position that makes it easier for them to breathe. And these are all serious warning signs. So I just want us all to kind of be aware of these, because this is time to get medical attention, like 911 type of attention if someone is in respiratory distress. And I bring it up not only because, we have all these viruses floating around right now, but also because some of them don't have vaccines, they don't have treatments. And so it's important that we get attention, medical attention sooner rather than later, so that we can get the support that's needed. So remember that when it relates to RSV, we don't have a vaccine, we don't have treatment. So we're really just doing what we call supportive care. And so if you're doing supportive care of a little one at home, then of course, the most important thing is that you know the warning signs so that you know when to take them in for further attention. And aside from RSV, flu, COVID, there have been some other viruses floating around like metapneumovirus, parainfluenza. So not all of these are necessarily routinely checked for. So I just want to emphasize that just because someone has a negative test, but if they're having trouble, if they're in distress, then get attention. And just like what I'm hearing a little too much of right now, well, my COVID test is negative. I'm not feeling great, but my COVID test is negative, so I'm still going to go hang out. Let's please not do that. Let us not contribute to what's already a rough season here. If you don't feel well, stay home. If you absolutely have to go out, please wear a well-fitting N95 mask for what we call source control. This is not ideal. You can still get other people sick, but it's really the least you can do if you can't stay home, or even if you're at home around others who might be vulnerable. So let's just take extra cautions and try to get through some of these next weeks to months where we do anticipate cases going up, but it doesn't mean that hospitalizations have to go up. It doesn't mean that deaths have to go up if we are prepared. So remember, if you don't have a primary care provider, please get one and make sure you know how to reach them before you need them. And of course, as always, maintain a good state of health. Eat a nutritious, balanced diet, get some good activity and exercise, manage your stress levels, consider a multivitamin supplement with vitamin D, and get a good night's sleep. And please submit your questions or any feedback that you might have in the comments by direct message or by email to admin@rootsclinic.org. If you need tests, if you need masks, you can also email admin@rootsclinic.org or come by one of our sites and we'll be more than happy to give those to you. Thank you so much for joining us. We'll see you next Tuesday at 10 a.m. See you then.